All right, I guess we're live. We're good to go. What's happening, y'all? How y'all feeling today? Everybody's good?
Doing great. How about
All
yourself?
right. Listen, I can't complain. I'm hoping that I am actually live on IG, and I'm waiting for folks to let me know if I need to do anything else. Um, Hopefully, something will be posted in the chat to let me know. But we're live. Okay, good. All right, excellent. So I don't need to do anything. How y'all doing? For those of you joining us, my name is Chris Williams, CEO, founder of Heart, Body, and Soul, a Brooklyn-based nonprofit focused on Black men's health awareness initiatives. This evening, we have Dr. Maurice Hinson of MediRootz Medical Group and Hassan, Dr. Pooch Diop. I said it. Health educator at Weill Cornell. So this evening, we're talking about Me and My Prostate. Why Me and My Prostate? September is Prostate Cancer Awareness Month, but prostate cancer is something that, unfortunately, we're continuing to see high amounts of Black men diagnosed with prostate cancer, and unfortunately, at later stages. So I'm going to let Dr. Hinson dive into some of this stuff as a primary care physician. I'm going to let Hassan dive into this as a health educator at Weill Cornell. And we're going to chop it up here. So for those of you joining us, please, if you have questions, I want you to make sure you chime in and ask your questions, because we're putting this together for you. All right. So and bear with me one second, fellas. I'm getting a message about IG not showing live. So we're going to make sure that we do that. So let's get to it right now to make sure there's no issues. But in the meantime, bear with me. Let's see. We always got to deal with technical difficulties. It's good times. Never fails. Now, my question is whether or not I'm gonna have to ask Ange. We might have to do something here to make sure that there are no issues. So let me know. I'm talking to my tech support, making sure we're good to go in the back. Guys, you're quiet, man. You let me die all by my lonesome.
Yeah. We're just letting you run the show, and you're the captain of the ship, so you got to.
I'm the captain of the ship. So if you're joining us here, you can also get us on IG Live on our IG page, which is I Am Heart, Body, Soul. So we want to make sure that that's live as well. And from what I'm hearing, we're not live there. So I'm going to wait for tech support to do their magic and make sure everything is good to go. Let's see. All right. Can you guys hear me?
Yes.
Oh, yeah.
All right. I think we are live. Now, I think we should be live. So just let me know. I'll talk to the team, but behind the scenes, just check that other information I sent in. Right now, we should be live on IG. So if everyone can check and give me feedback and make sure we know that. But again, once again, my name is Chris Williams. This is Heart, Body, and Soul here talking to you about Me and My Prostate. And Heart, Body, and Soul, like I mentioned, for those of you just joining us, is a Brooklyn-based nonprofit focused on Black men's health awareness initiatives. We do this. We want to make sure that we really want to make sure that our brothers and we're having some other technical glitches, but we'll figure it out. But we want to make sure that our brothers are getting access to information and resources they need to screen early. We want to make sure they get access to all the resources they need if they run into any issues and are diagnosed with prostate cancer and are underinsured, uninsured, or dealing with situations of being undocumented, that they have access to quality care if they get diagnosed, unfortunately, with prostate cancer. So with me this evening is Hassan, Dr. Pooch, Diop, and we're going to talk to Hassan about how you got that Dr. Pooch moniker. He's a health educator at Weill Cornell and well versed in the space of prostate cancer, and I know a number of other things. And then also joining me is Dr. Maurice Hinson, who is with us here from MediRootz Medical Group. So I'll let them introduce themselves, and then we'll get on the way.
All right. Thank you for that, Chris Williams. Happy to be here, first of all. It's an honor. And so I'm representing Weill Cornell Medicine. I'm a health educator at Weill Cornell Medicine. I focus specifically on prostate health education. So like you said, there's a disproportionate number of Black men that are being diagnosed with prostate cancer. And we're going to get into the weeds of it, why that is, at least to the best of our ability today. But it's a growing issue. The name Dr. Pooch, as you, the moniker, came, I don't even know where it came from. All I know is my whole life, literally my whole life, before I was able to speak and even say my own name, my given name, which is Hassan, I've always been Dr. Pooch. My family has called me that, and I have other extended family, aunties and such that helped raise me. And when they were introduced to me before speaking age at 1 year old, I was already Dr. Pooch. So it's a name that kind of stuck with me, and I found identity as I developed my passions for health, holistic health, and began to go into that world. So I really, I shied away from it. It was just a family nickname growing up, kept within the small circle of the family. But I adopted it and want to tell the world who Dr. Pooch is, because I focus on children, specifically children's health education. So think of Dr. Seuss meets Dr. Sebi. That's what Dr. Pooch represents right now to the world. It's a collage of those things. And I could talk for days about the work that I do, but right now I'm at the capacity of Weill Cornell Medicine health educator. So thank you for that, Chris.
Excellent. Dr. Hinson, please go right ahead, sir.
Sir, yes, sir. Well, first and foremost, it's an honor to share the stage with you once again, this E-stage. My name is Dr. Maurice Hinson. I'm a general internist by training, naturopath by spirit. I'm currently a hospitalist at Jamaica Hospital Medical Center, as well as the founder and executive director of MediRootz Medical Group, which I'm representing here tonight. My take on prostate cancer is the same that it is for most other chronic diseases, that is almost entirely preventable, but it's a matter of us becoming aware of our risks, being mindful of the decisions that we make regarding our health, the choices that we make regarding what we expose our bodies and our minds and our spirits to. Because disease is not, this simple thing, this linear pathology that we all make it out to be, and its treatments aren't simple and linear as well. These are complex issues that have to be resolved through complex measures, and it takes looking at things from a holistic standpoint in both the disease progression as well as in the therapy for us to appropriately address the issue. And that's what I tend to do. I tend to look at every disease state from this holistic lens and use both conventional methodology, so Western medicine techniques, in addition to traditional medical practices, like those that have been around for thousands of years. And I think it's the marriage, the amalgamation of the two that allows and affords the greatest therapeutic benefit. And so I'm hoping this discussion tonight will reveal that. I see Dr. Pooch, he's already mentioned. I can already see where a line is. You said Dr. Sabi meets Dr. Seuss. I think that's what you said, right? So
Yeah,
I think we're already connected. I'm a huge fan and follower of Dr. Sabi and his overall philosophy about eating alkaline and avoiding certain things, and us being electric, and therefore we have to consume things that are electric. I'm a fervent believer in this, and I think it's one of the greatest, or at least the underappreciated elements of our being, in addition to us being spiritual beings, before anything. And I think Western medicine has completely negated this fact, which is why many of our therapies are highly ineffective. All right. So I think it starts with incorporating the spiritual self first, and then everything else will follow suit. So really looking forward to the conversation.
Yeah, listen, I can't thank you both enough. A big thing that concerns me is, and we've talked about this offline, but when we look at prostate cancer and prostate screening, unfortunately, our men seem to have this notion that there's a problem. It's like they don't want to go in and get a rectal exam because for some reason they think it violates their manhood. Just talk to me a little bit about, and I'll start with you, Dr. Hinson, as an internist, as a primary care physician, what the process is like, and whether or not it's even necessary nowadays to do a rectal exam.
Yeah. I actually remember being in med school. We have all these clinical clerkships, and where we're taught how to do physical exams and all those things, and it came time to discussing men's health and prostate health, and how to correctly perform a digital rectal exam. And I remember at least initially it was on a mannequin, but then they actually brought out a human subject. And I remember just how.
Wait. So now we're officially live on Instagram, right? So for folks just joining us, I just want to recap, right? So, we're talking about Me and My Prostate. Very important for those of you joining us. And we're having a conversation with Dr. Maurice Hinson, who's a primary care physician, an internist, and founder of MediRootz. And we're talking to Hassan, Dr. Pooch Diop, who's a health educator over at Weill Cornell. And we're talking about sort of breaking down the stigma around getting a rectal exam. And Dr. Hinson, you were just telling a story. You're sharing something. Please go right back into that story about it being in medical school and doing this procedure.
Yeah. So as I mentioned, so initially, they had us they were teaching how to, perform a digital rectal exam, and we were doing it on a mannequin initially, and then the follow-up session was an actual person, a human subject. And I remember just how awkward that was, and it wasn't for the subject, the patient, but rather for us, because the whole time he's telling us, how deep to go and where to place our finger and how to manipulate the prostate. And it's, it was to have someone talking to you like a normal conversation like we have while your finger is up their rectum. It just wasn't, it was just an awkward position to be in. But it made me understand how, at that time, how necessary learning the process was, and how much we had to get over the hump of, looking at it as some type of violation of our manhood. Because this gentleman, he was really all about teaching us, what, and we're all in this rectum, and he's focused, and I said, man. But I also recall when I was a resident and doing my first digital rectal exam for a young guy who was having increased urinary frequency in a weak stream. And I went in to speak to the preceptor, and he said, well, we're gonna have to do a rectal exam. And it was, it was almost traumatic to the brother. And I was like, man, seeing the stark difference, between the gentleman who was teaching us and the patient who actually saw me in the clinic. I was like, and the brother ended up having an enlarged prostate. And we treated it medically. It wasn't cancer, thankfully, but for him it was a relief, because now he actually knew what the issue was and we could treat it effectively. But the whole point of this is that we have to get around the stigma of doing things that are somewhat uncomfortable. This whole attack of our manhood and like that, there's nothing manly about dying from something that's preventable, for leaving family and friends behind because, you wanted to maintain this sort of macho mentality, and that's, that it's unproductive, and it only leads to severely worse outcomes, because as I mentioned, prostate cancer is almost entirely preventable. But now the guidelines don't even really recommend having a digital rectal exam. We can do these other screening options like a PSA blood test, so now we're at a point where, there really is no excuse, not to go and get screened and prevent an issue before one starts.
Yeah, I'm glad you brought that up. Hassan, I want to talk to you a little bit about what some of the things Weill Cornell is doing in this space, right? And sort of where we are also with the recommended age to screen, and sort of this new development of being able to screen without the digital rectal exam, but going the route of a PSA. So let me let you take that away.
Yeah, so that was a great transition. So now technology is kind of catching up to that emotional stigma that men have, specifically Black men have, about the famous DRE, right? That Dr. Dre, I call it, the DRE, yeah, the digital rectal exam. We tend to. Men still have that stigma, and it may have started in popular culture with the famous Jamie Foxx, the stand-up, comedian. He did a stand-up, and he was talking about the details of that and his feelings behind it, and him having such a large platform obviously influenced a lot of men that this is the only way, and that was the standard of the day. So there wasn't really anything to bypass that. But now technology has reached a level where we can measure the prostate-specific antigen. That's what he mentioned. PSA stands for prostate-specific antigen, with a simple blood draw. Soon we're going to be able to prick the finger just like we do a glucose test for a blood sugar glucose, and like a diabetes test, and you just prick the finger and you'll be able to test the PSA that way. So science is making it much easier to detect a high level, which the PSA simply levels the hormone, that antigen rather, the PSA. And if it's a high level, then we can see, we can further investigate, but it's a non-invasive, simple way to check what's going on. So, I think it's great. What is going on as I'm out in the field, a lot of the pamphlets that I have from the state, for example, mention either 55 years old or the youngest age is 45 years old, right? To start testing for prostate as a man, right? Start getting tested. I'm out in the field, I'm hearing stories, just talking to Black men specifically throughout Brooklyn, throughout Manhattan, throughout, you know, the different boroughs. And I'm hearing 37, 38. So which means biologically, men, and as a culture, I think, we're aging faster because of the processed foods, because of, you know, the lifestyle that we're leading. We're aging biologically faster. So a 37-year-old biologically, in his body, in his, you know, cells and, you know, genetic, like his biological makeup is actually older now. You're a 37-year-old, 35-year-old, maybe 45, maybe biologically 50. So it's not necessarily the times around the sun, right? That you've gone, or how many birthdays you've had. It's your biologic age. So something is happening where we now have to be in the field and start testing at 40 years old. Now 40 years old is the mark, is the lowest level that we can assist for free. You know, we have tons of resources at Weill Cornell. We can help pay if you don't have insurance. We have tons. Any barrier that is preventing any person from getting tested, we can help you overcome that barrier. But now that first step starts at 40 years old. So something is definitely going on. And I appreciate Dr. Hinson understanding the holistic view, that it's not just A plus B. There's a full range, there's a plethora of things going on that are affecting us, not only on the physical, emotional, stress, everything is compiling. And now here we are in this situation where men at 37, 38 years old are beginning to have these symptoms of inability to have an erection, painful urination, like, you know, the doctor was just saying, like a slow drip type of urination, meaning something there is blocked. Men don't really even understand where the prostate is. Like, if we were to take a toll or to take a survey and ask men to locate their prostate, and even in the field ask women to locate, if women don't, there was an event that we had, and a woman was actually mad at us that she couldn't take the prostate test. She thought that we were discriminating against her. We said, no, you simply don't have a prostate. And so there's a fundamental misunderstanding about our own biology. And that's why it's necessary. I think understanding that could even help men overcome the stigma of having to, you know, access that area through the digital rectal exam, because they don't really see the correlation between the location of the prostate and the rectum. So there's a lot of education there's a gap in education that needs to be filled, you know, so to change the culture around this specific issue.
And that's what we hope to do with as we work together, right? All of us here are doing the work. Dr. Hinson is in the field. He's in the hospital. You're in the field. I'm out in the community as well. And so, you know, hope with this call, with all our initiatives, we'll work to change that. But you mentioned something, and I'm going to circle back, and Dr. Hinson, I'm going to ask you to jump in after, but you mentioned something specifically about the age and about it starting at 40, right? Which is a good thing. There's still some hospitals and I think some cities that haven't caught up to that. You know, they're still unfortunately looking just at 45 and up. But what about the instance where someone's father, for example, may have been diagnosed at the age of 40 or 45? How does that look, and when should they be screening?
You would like me to answer?
Yeah, both you and Dr. Hinson, because I know you're out there, so you're doing this work, so you have some idea.
Yeah, so definitely if there's a family history, unfortunately in our community as well, we don't tend to talk about what happened to such and such person. If there was an issue of, especially a medical issue, or unfortunately a death in the family, maybe the extended family, we don't talk about what really happened. How did this person pass away? We tend to keep things, respectfully on the low, on the hush, and just he just died of complications, right? So these things, the specifics of it need to be addressed first of all, so we understand our own family history and the medical history within our family. Because if these diseases such as breast cancer, for example, prostate cancer, they run in the family. There may be a genetic component that can increase somebody's chances or likelihood to develop a prostate cancer early on, especially if their father developed it at such a young age. There's that much more reason to go get checked as early as possible to, if there is something wrong, we can address it hopefully holistically, or there's, definitely other medical procedures that can take place. But the earlier we catch it, we can have a comprehensive attack plan, right? Strategy to mitigate any of the problems. But if we let it go until it's far gone and develops into a cancer, then the options are much less. Let's just put it that way. So definitely, if there is family history, we want to make sure that we're on top of it. And that's why it's important to have these conversations. A lot of people, that's a question on some of the questionnaires that I have when I talk to people. And they, more than likely, I'd say over 50%, they do not know their own family history. Uncle, grandfather, the men in your family, how did they pass away? Or if they're living, do they still have an issue? Or what issue did they have specifically? And people, especially in our community, especially, and I understand it's out of respect, I think, that we tend to keep things quiet out of respect for another person. But these are life and death situations. We should talk about these things, because in terms of the percentage on the totem pole, we're the highest up there. We need to change something if we want to change the trajectory of Black men or Black families in America. The conversation is large, and there's a wide range of issues that we need to discuss openly and honestly.
Now, you said Black men, and I know we're doing this live on IG and Facebook and YouTube and so forth. So I want to clarify a number of things. So Heart, Body, and Soul is focused specifically on Black men's health awareness initiatives. Why? Because of the huge disparities that exist when it comes to things like prostate cancer, colon cancer, heart disease, and so on. We know and attest. You can attest to this. Dr. Hinson, you can attest to this, Hassan, in your work as a health educator, that the numbers for Black men in terms of their prognosis with these diseases in comparison to white men, Asian men, and so forth, it is, if not 2 to 1, 3 to 1, sometimes even more, right? And so what we have to do is do the work to lower those numbers and get it to a place where hopefully these outcomes are significantly better and we're not being diagnosed at these stages. So this is prostate cancer awareness is something important for all men. We want all men to be aware of what's happening and go out and get screened. But we're specifically focused here in this conversation around highlighting Black men and their importance. The reason why it's important for them to screen early, the reason why it's important for them to pay attention to their bodies if something doesn't feel right, and have conversations with their doctor, starting with the primary care physician like Dr. Maurice Hinson. So I'm going to segue to you, Maurice, and talk to you a little bit more about, so we hear prostate and cancer. So tell me a little bit. I know you're not a urologist, but I also know you know a lot of things, brother. So, the prostate cancer, like, talk to me about the first of all, identifying what purpose does the prostate serve, and then, define the whole cancer and how that comes about. And, if you can just dive into that a little bit so people are very clear on what this is.
Yeah. So the prostate produces a fluid that helps your semen to survive. So it coats it, provides nutrients. And so, when you ejaculate this prostatic fluid along with your semen. Okay, so that's what the prostate is for, its main purpose. And it surrounds the urethra. All right.
And it's a walnut size, right? It's like they say it's like a walnut size.
Correct. But, it naturally increases in size as we age. Like that's a natural occurrence. There are instances where it becomes too large, but it's not cancer, and we call that BPH, or benign prostatic hypertrophy. All right, and because it surrounds the urethra, if it enlarges, either due to BPH, natural age, or cancer, it can cause urinary symptoms. So it could cause a weak stream. It can cause increased urinary frequency, where you feel like you have to use the bathroom a lot. And in some instances, it could cause discomfort when you urinate. All right. So any sort of urinary symptom that you may have, you should obviously go and get it checked out. Okay. I think where the whole premise, where the cancer comes from, cancer is a chronic disease. Okay, there are a number of other chronic disorders like heart disease, high blood pressure, diabetes, high cholesterol, dementia. These are all classified as chronic disorders. So it's not like prostate cancer is necessarily due to an infection. There are genetic predispositions for prostate cancer. This is why, as Hassan was mentioning, learning from the family. We do ourselves an injustice not speaking to each other within the family. And again, that may be a cultural thing, may be out of respect, but it at the end of the day, it harms us generationally. Transgenerationally. We need to learn, we need to be open and start having open discussions about our health, because there are certain situations where you're at increased risk for cancers because you have a genetic mutation, which could be easily identified and prevented, if you know. But again, you have to be aware that this exists in the family in order to address it appropriately. There are some genetic mutations that are associated with prostate cancer, but these genetic predispositions aren't as prominent as, say, they are in breast cancer, for example, where we know about the BRCA1 and BRCA2. There is a BRCA1 and BRCA2 mutation that increases risk in prostate cancer also, but again, it's not as prominent as it is in breast cancer. All right, I think cancer overall, as I mentioned, is a chronic disorder. And what we're learning in the scientific community is that most chronic disease, like the ones that I mentioned before, the heart disease, the high blood pressure, diabetes, dementia, cancer, these are the sequela of chronic inflammation. Okay. And this is where Dr. Sebi used to tell us this, 40, 50 years ago.
Pause 1 second. You just dropped a word on me, sequela. I believe I know what it is, but tell me what it is.
It's just like a consequence.
Okay.
You have chronic inflammation. When you allow chronic inflammation to go on, it can result in the development of these chronic diseases like cancer. Okay. Cancer is not necessarily something that happens right overnight. It's a buildup. And that buildup is usually the result of chronic systemic inflammation. And as I mentioned, this is something that Dr. Sebi used to tell us 40, 50 years ago. And I think his famous phrase was, mucus is the cause for all disease. You get rid of the mucus, you get rid of the disease. He was telling us something then, right? Because where does mucus come from? Mucus is a byproduct of inflammation. Okay.
That's right.
So he was effectively telling us is that it's inflammation that causes these disease states. All right. And that's true for cancer. All right. And what we know about chronic inflammation, or at least I created 4 buckets for things that drive chronic inflammation. One is infection. All right. Viral infections, bacterial infections, fungal infections. Infections lead to inflammation. That's a body, and I have to make this point. Inflammation is a natural protective process that the body uses as a defense. However, when the body has to constantly defend itself, it eventually becomes weak. You understand? So, infections, viral infections, bacterial infections, fungal infections. That's one bracket. There's another bracket which I call toxic consumptive. So things that we consume that are toxic to our body. So toxic air. Okay. Lung cancer is another area that's a problem, right? Because everyone focuses on tobacco smokers, right? And the risk of lung squamous cell carcinoma, right? But actually, the lung cancer that has been increasing the most is lung adenocarcinoma. That's not related to smoking, all right? And I imagine that that's due to the increased amount of toxins that are present in the air that we breathe. We're constantly exposed to these toxins, okay? So toxic air, toxic beverages, all right? And probably the most detrimental is the toxic foods. The food that we eat now are stripped of all nutritional value. They're ultra processed. They're high acid forming. Again, this is another Dr. Sebi plug. He used to preach we have to eat alkaline. And what's interesting is he was demonized so much for his approach to medicine. However, now we're doubling back and confirming exactly what he used to say. So right now, I would say around the late 1980s, early 1990s, they began studying this parameter, which they're calling potential renal acid load, PRAL, potential renal acid load. And this is basically the amount of acid that's produced by the food that you consume, okay? And they discovered that diets that have a high PRAL, that have a high potential renal acid load, are associated with poor health outcomes. And that diets with a low PRAL are associated with good health outcomes. So the foods that seem to have the highest acid load, dairy, in particular cheese, okay, gelatin, processed meats, okay, processed foods, period. These have a high acid load. So if you're consuming this type of diet, which is what characterizes the American diet, the Western diet, then you increase your risk for the development of these chronic diseases. All right. So diet, toxic consumptives being that bracket. I also put in there toxic thoughts. All right. Toxic words. All right. Now we're getting more into the metaphysical, right? But these things have a huge implication on how our bodies operate as well. If you think negatively, that primes your body to act a certain way and to respond a certain way. And that response is usually increased vulnerability to infections and other disease states. All right. So toxic thoughts and toxic words play just as much of a role in the development of chronic disease as I would say any other toxic consumptive. Okay. The next one I would say is poor flow. Okay. So poor blood flow, poor lymphatic flow, poor flow of what the ancient Chinese called your qi, and what the Hindus call your prana, what the ancient Africans called your ka, right? That this vital energy. You know, this is where like acupuncture comes in, and Reiki, and all these things that move your energy. Okay, blood flow, lymphatic flow. This is where massage therapy comes into play, right? Because when blood is not flowing the way that it should, toxins build up. Localized toxins cause inflammation. That localized inflammation becomes systemic after a while. And as I mentioned, chronic disease is the result of chronic inflammation. All right. Your lymphatic system. If your lymphatic system is not draining appropriately, those toxins build up in that local tissue. All right, and that causes inflammation, and that becomes systemic. The other flow, waste, right? Urinating. This is why we need to hydrate and urinate appropriately. Moving your bowels. If you're not moving your bowels daily, that means those toxins are remaining in your body. Okay, so going to the bathroom only 2 or 3 times a week is not healthy. If you eat every day, you should be moving your bowels every day, at least once a day. Okay, so and then the last bucket is stress. Okay, and this is the area a lot of us don't really aren't quite mindful of, but chronic stress leads to chronic inflammation also, because when you're stressed, you activate this part of your autonomic nervous system called the sympathetic nervous system. The sympathetic nervous system is responsible for your fight or flight response. Okay, one of the hormones that are released during this fight or flight response is cortisol. It's a steroid. All right, steroids acutely actually act to suppress inflammation, but when the body is constantly exposed to steroids, it actually flips the switch and becomes pro-inflammatory. Okay, and some of the other things that cortisol causes, it causes increased blood sugar. When that happens for too long, what's that called? Diabetes, right? It causes increased retention of sodium. With sodium comes water, so that increases your blood volume, so that increases your blood pressure. If that happens for too long, what's that called? Hypertension.
Hypertension, yeah.
Right? And cortisol also forces you to retain fat. Okay, so when you're constantly stressed, when you're constantly in fight or flight mode, when your sympathetic nervous system is constitutively active, that's the scientific term, then eventually that leads to a pro-inflammatory state. And again, chronic inflammation is what results in chronic disease like cancer. All right, so I just gave you the 4 buckets for how chronic inflammation leads to the development of these chronic diseases like prostate cancer.
I feel like you need to teach a class or something. I mean, classes. I mean, I'm not even saying this because I know you. I'm saying this because I know your knowledge, right? But what you just shared is, I mean, folks, if you have questions, I want you to chime in and ask them. And as our moderators behind the scene will share them, and we can happily answer. But this is an opportunity to get some more insight. And Maurice, thank you for what you shared there, because it's really powerful information, and it's information that you and I have had conversations around this for quite some time. And I myself as a cancer survivor, not prostate, but cancer of the appendix, and as a 2-time heart attack survivor, I understand all too well the importance of making sure that what I consume, stress, things like that, are not causing further harm, as I continue to do what I do. So it's very important that we pay attention, folks, to all the information that's shared here. We talked about, cancer, prostate cancer, the prostate, what it is. Hassan, you talked about what Weill Cornell is doing. One of the things I want to touch on is the first line of defense. Who really should be your first line of defense in terms of identifying whether or not there's a problem? And once you have that first line, how do you make sure? Well, first answer that question, and we'll go into the next one.
You would like me to answer the question?
Any one of you. This is open to both of you.
Well, I'll chime in. Dr. Hinson, that was such a great breakdown. I want to, I was applauding you while you were talking, because it's not spoken of as much as it should be. And I went off camera a little bit because I was looking for one of my children's books. I have a children's book called Inflammation Nation. Mm-hmm. And in that book, I start off, well, early on in the book, I say, you are what you eat is the mightiest statement, because the pain that you feel in your food are related, right? So that's first and foremost. And then I identify different inflammatory diseases, which arthritis is an inflammatory disease, asthma is an inflammatory disease. All of these things that are prevalent in our society are inflammation. And then so to sum it up in that book, in the conclusion, I said, now I hope you can use reason and logic and know that disease comes when inflammation is chronic. And so, it's literally this. So how do we get out of a state of chronic inflammation, which you hit on the head? Inflammation is coming in to actually save us. It's like the rescue team coming in. It's like the ambulance being called in, or the fire department. Let's put it, inflammation, right? The flame. So let's say the fire department is coming in, but the fire just continues on. I mean, you could imagine, if with a forest fire or whatever, how exhausted and beat down the firefighters are after fighting a forest fire on a massive scale. That's what's happening in our bodies, and they can only do it for so long until it develops into something else. Okay, so I didn't quite understand your question. What is the first line of defense? Like, who should we call? Or
well, I think what I'm getting at is you're having these issues. You're as a man, I'm home, I'm experiencing some issues. Who really should be the first line of defense? Who should I be going to see first if I'm experiencing any issues with urination or anything of that sort? Should it be the primary care physician? Which, that's what I would say. But I just want to get a sense from you as to where people should go, because people need to understand it who are logged in here, whether they're men, women, whatever, to share this information so they understand like who they should be going to see first. Not just going to the ER, but what doctor should they be seeing?
Okay. So even before the doctor, I think that they should talk to their family about it, right? Their significant other, their household. They need to start there. And then I would definitely start off with a PSA, right? Go the easy route first and see if that leads into something else, and then we can investigate further. If you do go through your primary care physician or urologist and they end up doing a digital rectal exam, and let's say there is an issue, I would say seek out holistic counsel. Seek out a holistic practice like a naturopath. You mentioned Dr. Hinson early on in this live stream, a naturopathic route or some type of holistic route, which looks at you as a whole person, your family history, maybe the certain gene expressions. They're looking at your diet. They're looking at your stress. They're looking at how you manage that stress, right? They're looking at you as a whole person. So that's what I would recommend. If I had an issue, any type of issue, I would seek the professionals in that field, but I would also seek someone who has a holistic vantage point for me as a whole person, and not just a specific isolated part of my body.
Understood. Dr. Hinson?
Agreed. Yeah, no, I agree wholly. And that's, I regard myself as a integrative practitioner, because I see the advantages of Western medicine, but I also see its limitations. And one of the greatest failures of Western medicine is inability to really appreciate the body in its entirety. It tends to reduce everything down into individual components and then treat those individual components. No, but what you're treating is a system. And so you need to regard it as such. And your approach to addressing problems with the system needs to be far more comprehensive. And so added to that, you need to find out what the underlying reason is. Western medicine almost prides itself in symptom management, right? Even the way we define disease really is a symptom, right? Diabetes. And diabetes, your blood sugar is elevated. That's not the disease. That's the symptom of an underlying problem, right? Hypertension, we diagnose as elevated blood pressure. That's not the disease. That's the symptom of something occurring, something underlying occurring, right? So what we really need to do is to address the root cause of the disease. And there's an area of medicine called functional medicine where they look at that, right? And what Hassan was getting at, there's so many different elements to a person, and in science we call it the biopsychosocial determinants of health, right? You have biological reasons for your health, you have psychological reasons for your health, and you have social reasons for your health, right? And all of these play into who you are as a person and the state of your health and well-being, and I think it's critically important, and I agree wholly, to view these things holistically. And so I think the first person, or your first line of defense, I think, has to be the ones who are closest to you, especially your spouse. It's no surprise. It should be no surprise that men with spouses live longer. Because your lady will get you out there to go see the doctor. Women are far better at taking care of themselves and actually going and see the doctor than men have been historically.
So you're saying we should get married? Is that what you're saying? You're saying that I should get a wife?
Yeah.
Hassan, you married?
Yeah.
Okay,
Yeah.
so he's got it already.
Yeah,
so I should get married. I got you.
He's got to outlive all of us, So, but that's what the data shows. So I agree. Talk to your family. We can't. There's this term being thrown around called toxic masculinity, right? I push back against that. Usually, because I don't. There's nothing wrong with being masculine. I think it sort of attacks masculinity entirely, but I think what is attempting to get at is this machismo that we use that stops us from having the common sense to go and seek help when something is wrong, right? Like, there's nothing wrong with being stoic, right? In fact, I think men should be stoic. We're not women. Don't get me wrong. There's nothing wrong with expressing and verbalizing your emotions. And when you're in pain, I think we need to do a better job of that. But, it's nothing wrong with being stoic either. But don't be stupid. If something's wrong, go seek help. No, you don't have to sit there and cry about it and moan about it, but go seek help. These are two different things.
Yeah. Stoicism. I mean, I've been a practitioner. There are times where it is required. I know this year when I lost my mom, I mean, I had to be stoic. There are things that I had to get done. So while it was emotional for me, what I had to focus on is executing on certain things. Those things that I had to execute on were to make sure that my family who's here had the support, had me focused on moving the necessary pieces. Of course it's rough. And of course but like you said, you have to take the time out to seek the help when it's necessary. So I do want to take a couple questions, and we have one from IG. This gentleman says, I have a prostate exam next month because it's enlarged. What are my non-invasive options?
Well, first, my question is, how do you know it's enlarged?
Right.
Yeah. I don't know if he's still on, but let's
I'll go further. So, let's say, for example, you know that it's large because you've been having urinary symptoms, maybe increased frequency. So you went and saw the doctor. The doctor said, okay, well, let's get an ultrasound. And they did a bladder and kidney ultrasound. In the ultrasound, it showed that your prostate was enlarged, and they're recommending further imaging for clinical diagnosis. I think in this setting, you can still stick with a PSA, because the PSA will let you know if it's something concerning, right? And something that may need to be followed up on, and then actually have something invasive. But having the large prostate itself doesn't necessarily mean that it's something of concern. Again, a lot of men, as we age, our prostate enlarges naturally. And some of us, it enlarges to the point where we consider it to be BPH, or benign hypertrophic, benign prostatic hypertrophy. And, that's just managed with medication.
So he did answer that he had an exam prior. So that's how he knew it was enlarged.
Okay. And in the prior exam, I would imagine, because you're going back for another one, that there wasn't something necessarily concerning on that exam. And so for me, if I have someone who comes in and they're having, these urinary symptoms, and there's concern for, maybe there's prostate cancer in the family, we're doing the PSA, when you come to see me in the office. I have a family history, and I'll give my own story just to make it relevant. So I have family history of prostate cancer. My brother got it. I believe he was diagnosed in his 50s. I have a cousin, I have an uncle, and this is on both sides. All right. So there's prostate cancer both sides of my family. I'll be 38 this year. I've been getting the PSA during my annual since I was 35. That's just a decision that I made with my primary care doc. I said, look, I'm higher risk. I just, if it's a simple blood test, just send it just to screen. So, I would say it really depends. I don't know the exact, the specific circumstance of what's going on, but, I will look at other types of red flags too. Weight loss. If you're having a significant amount of weight loss, then I think you have to be more aggressive about, screening and, the digital rectal exams or actual biopsy. I wouldn't play around if we have some of these other, so-called red flags associated.
Yeah, and it sounds like from your response, to really dive deeper into giving non-invasive options, we need more information, right? It's not as simple as I'm having this, I have an enlarged prostate and going back in for another exam. What else did they find? What else, what other information is available to really help us give you a better answer? One of the things I would encourage anyone who's here now listening to this, we have an event on Sunday, September 15th in Brooklyn at Lips Cafe and Aunts and Uncles. That's 1407 Nostrand Avenue and 1412 Nostrand Avenue on Sunday, September 15th from 11 a.m. to 4 p.m. I encourage you to come and join us. Weill Cornell will be doing screenings on site, free prostate cancer PSA screenings. And we'll be having conversations with survivors and with a very well-respected urologist, Dr. Alfred Winkler, who's also Weill Cornell urologist. So we'll be diving into a number of conversations and touching on more deeper information regarding prostate cancer. So if there are other specific questions, if there are things that you're concerned about, if you want to get screened, which I encourage all men to get screened, I encourage my brothers, Black men, to come out and get screened. That's the place to do it. So please come and join us then. There was another question that was on, and I'd love for our team to put that back up with regards to How do you start the history conversation with a stubborn family? I've heard this before. I'm sure you've all heard this. What are your thoughts? You want to know your family history, but you have a family that is hell bent on keeping things quiet, or saying well, Mikey we don't know, he just passed away. What are your thoughts?
Well, I would say now we have so many tools. Like right now, we're all in the same room technically, but not physically in the same room. We have so many features, for example, on Zoom, where people can take tallies or input information. We have like a questionnaire type of situation where you can take a toll. There are many different ways that you can be creative, where a person doesn't necessarily need to know it's Uncle Mikey or grandfather, whoever, grandpa, whatever name. We don't need to know the specifics. Are there any men in the immediate family that passed away from this issue? Check yes. Are there any women that, and we can, for whatever issue it may be, we need to understand in a general sense what our family has dealt with historically. Not only, we need to get better at dealing with trauma and to learn to express that in healthy ways. So I think we don't need a specific, Uncle Johnny is not, it's not relevant that it's, Uncle Johnny on mom's side or, whatever. We don't need to get in the weeds of that. We can just answer in a way, hey, mom, did anybody in your family ever have this issue? You don't need to let me know specifics if you don't want to talk about it. But for my medical history, I need to know, And so we maybe, with further context, we can appreciate the value of that conversation within the right framework and the right context. I think no elder in our family would really hold that information and really just, covet that information given an appropriate context. And maybe if they really feel a certain ways about it, just eliminate the specifics of it. We don't need to know exactly who. Just let us know in a general sense, has this ever happened in our family? And maybe later on we can talk about it at the next family Zoom meeting or at the next family barbecue or whatever we do in our togetherness. We can talk about that later, but just like you would fill out a resume, we need to have medical histories and understanding our medical history. So when we do go to the doctor, we go more prepared. But a lot of times doctors ask us questions and we just don't know how to answer, but like the doctor said, we need to know a little bit more, because one question leads into another one. So the more information, the better when it comes to addressing certain issues is my thoughts on it.
Appreciate that, Hassan. Dr. Hinson, you had anything else you want to add before I get to the next question?
No, I think you just got to get to it. You got to have the combo. I think people like to beat around the bush. I think you just have to be direct.
Yeah, 100%. And I'd also say this is to Hassan's point, like no family member that's living wants to see you join your ancestors, right? Especially join too early. So the goal is maybe in broaching the subject, just say, hey, listen, I have to go to the doctor. I have to see some specialists surrounding XYZ. And they ask for my history because that information will help them determine how best to test me, how best to maybe address whatever issues and so forth, or whether or not there is an issue. And if there is, what I need to be doing frequently. So, it's all about bringing it down, not so much making it, like you said, spotlighting. Oh, well, Mike or Desmond or Neville, or Trevor died of this and or we heard you don't have to focus on that. Just focus on the fact that listen, I need the information for the doctor to make better decisions around my health so that, you know, we can be here to celebrate my birthday next year. Another question that came in from IG is, as a Black woman, not me, but this person is a Black woman. How can I support or encourage Black men to get these kind of checkups?
I think
any one of you can take that.
That is, Black women are going to be our saving grace in this conversation, because men really do not want to deal with doctors. They don't want to, you know, I find a lot in the field, men will just avoid the conversation. Hey, yeah. Oh man, yeah, I'm on it. Hey, I'm gonna be right back. Okay. And then, you never see him again. And so we kind of like run away from this situation. A lot of time, Black women, when I talk to them, sometimes they just want to pray the situation away. We can't do either of them. But definitely women are the ones who can break through the emotional barriers for men. Because it's really an emotional, I'm a man, no doctor is gonna bend me over. You know, it's a like the doctor said, it's a machismo thing. It's, you know, but it's not about that. And a woman has the sensitivity to understand the emotional aspect of that particular man, to get him to overcome and really give him the courage to overcome, not only the courage, but the accountability, because he has to come back home and deal with that woman, you know?
Yep.
So, you know, a Black woman is the front line to this whole conversation, this whole piece, really, that I've seen in the field, and that's why I emphasize having a spouse, having a woman at home, because your lady is going to know, or your significant other, let's just keep it general, is going to know if you're getting up multiple times at night in the bed, right? They might even put 2 and 2 together before you, because a man is just, all right, busy, let's just handle business, and we're not really doing the internal check-in, like what's really going on with my system, why am I, or if you're having issues where you can't even, you have painful ejaculation or painful, things like that, that becomes an issue that can play into the relationship. So you would want your significant other to give you the courage to go ahead and address that. But that's, I think, Black women can be our strength, really, because we need that strength and accountability.
Yep. I think we have one last question and then we have to wrap up. But this question comes in saying, should I get a PSA test if I'm not having any issues? And if yes, how do I get one? So we talked about this, and you can put a cap on it in terms of age and so forth. But go right ahead, Hassan or Maurice.
Okay. If you're 40 years old or up, between 40 and 70, you can absolutely do that. Come to our event on the 15th. And we have an option if you don't have a primary care physician. Even if you do, we can help you on the spot, get a free PSA exam, and that's your first step. So simple, come and see us, come to the event, break bread with us, and you can check that off the list, and then just talk to your primary care physician once a year thereafter. And you can monitor, you can have that baseline of what it is in 2024, September 2024, and next year, 2025, we can see what happens. As Dr. Hinson said, it's naturally going to get larger as we age. And there are other, dietary and lifestyle factors, of course, that can increase that, the growth of it, but it does grow as we age. So we can monitor that through a simple PSA. It doesn't have to be invasive. It doesn't have to be embarrassing. It doesn't have to be traumatizing. A very simple, free solution.
Yep, 100%. And like we said, it's this Sunday, September 15th, from 11 a.m. to 4 p.m. We're going to be at Lips Cafe and Aunts and Uncles, which is directly across the street. So there'll be lots of information. There'll be some music. We have a DJ there. We have lots of great food that, by the way, will be free. So we have some great food prepared by both restaurants, because the whole idea is community. So we want our Black men to come out to get this screening, but this is an open event to all. So families, bring your family, bring your spouse, your girlfriend, your significant other, come out. This kind of information is valuable to everyone. So we want it shared. We want it to be a shared experience. So we look forward to seeing you then on Sunday. Gentlemen, thank you very much for your time. I appreciate both of you for taking this time to provide this level of information for our viewers. You can learn more about Heart, Body, and Soul by visiting imhbs.org. Please make sure you check out Dr. Maurice Hinson at MediRootz. That's MEDIROOTZ.com. That's correct? MediRootz.com. All right. And Hassan, Dr. Pooch Diop, health educator at Weill Cornell. Am I saying it right, man? Am I hitting
Perfect, man. You hit it on the head.
He's gonna be out there with us on Sunday, September 15th. But where can folks find you on IG or
Dr._Pooch, Dr._DR_POOCH, and then drpooch.com. That leads to all my social media sites.
Excellent. And Maurice, IG, where do they find you?
Yeah, we're MediRootz_Medicine. So again, as MEDIROOTZ_medicine.
Excellent. Thank you guys again. I appreciate it, man. I look forward to seeing you all soon on Sunday. And if you have any questions, if there's any more information that you need, please feel free to DM us at I Am Heart, Body, Soul on Instagram so that we can get the information back to you as soon as possible. Remember, health is wealth, and our goal is to make sure that you are extremely wealthy for the rest of your life. All right? One love, y'all. Peace.
Peace.